Hi, my name is Valera, and my project proposal is about pressure injury prevention in critical care patients, and I will be discussing effective strategies to prevent pressure injuries. Okay, so introduction. Pressure injuries, also known as bed sores, are injuries to the skin resulting from constant pressure on bony prominences such as the sacrum, shoulders, heels, and elbows. Pressure injuries remain a common challenge in the ICU. Despite healthcare improvements, these injuries lead to longer hospital stays, higher costs both for the patient and the healthcare facility. They cause physical discomfort, pain, and also increased risk for infection. So this project will aim to prevent pressure injuries among ICU patients, and it will be focusing on effective strategies to prevent pressure injuries with the goal to decrease their occurrence and promote a better patient outcome. Background and rationale. So pressure injuries, including those from medical devices, still pose a challenge in the ICU. So despite medical advancement, pressure injuries still remain a common issue. As I previously said, patient outcomes are compromised, leading to longer hospital stays, higher costs, and increased risk for infection. So a study done by Gao et al. In 2023 reported that there was a 27.9% incidence rate of pressure injuries, and a study by Bassam et al. 2024 indicated that there is a 59.2% prevalence rate globally. So this indicates that there's a high incidence and prevalence of pressure injuries throughout the world. One of the main gaps in current practice is that there's a lack of agreement on the key factors causing pressure injuries and also the optimal interventions to address them. So my project proposal will aim to identify an improved approach to prevent patients from getting pressure injuries by focusing on the bed selection and then other methods as well to ultimately improve patient outcomes. Okay, project objectives. So the main objective that I have is to implement evidence-based guidelines for bed selections and support surfaces to prevent pressure injuries in the ICU. And using the SMART tool, my specific goal is to analyze the effectiveness of interventions in preventing pressure injuries, and it is measurable as we can evaluate the prevalence and incidence rate based on these interventions. It is attainable using an assessment tool like the Braden Risk Scale, and this identifies the severity of the pressure injuries, but it also can mark signs of improvement. So this issue remains relevant as in the ICU many patients have pressure injuries or at a risk for pressure injuries, one of which could be from being bedridden, being immobile, or having poor skin integrity. And lastly, it is time bound as we can measure the incidence and development of pressure injuries from admission all the way to discharge for each patient in the ICU. Okay, methodology. So the main study design that I'll be using is a quasi-experimental design. This is a non-randomized group selection. So I'll have an intervention group, which is self-selected, and that'll be compared to a control group. This just allows for more accuracy as we can specifically choose which patients have pressure injuries or at risk for pressure injuries, just so we can accurately gather data. There's going to be a sustainable time frame for this as well, again from admission and discharge for each one of these patients. And the data will be collected from pre-intervention to post-intervention, and those will be compared to the control group. And overall, this is going to assess the effectiveness of the strategies used, again with the specific time frame from admission to discharge. Intervention. So the main intervention that this project will propose is the use of pressure redistributing mattresses. And a study by et al. In 2020 found a significant reduction in pressure injuries with the use of specialized mattresses. And this mattress distributes pressure by alternating sides of the patient. So based on their bony prominences or whichever side has pressure injuries, it'll redistribute that pressure accordingly. And secondly, we'll be reinforcing proper repositioning of patients. So in the ICU, at least every 2 hours, we'll be repositioning these patients as well with the use of the redistributing mattresses. And this intervention, again, is to prevent pressure injuries among patients in the ICU. And to assess these patients, we're going to be reinforcing the assessment tool of the Braden Risk Scale. So this is going to identify occurrences, the severity of the pressure injuries, and also any indications that there has been improvement of pressure injuries. So that has to be done consistently and needs to be reinforced as well. So the implementation process, so there's 5 total steps that I have. The first one begins with the initial assessment. This is just to acknowledge that there needs to be a change in the current practice and what resources need to be identified for a change. Next would be the training sessions. This is when the nurses need to be educated on how to use the mattresses, how to maintain them, and how to monitor patients on them. Okay. And then third will be selecting surfaces. So each patient has specific needs based on their current conditions. So that'd be another part of the process. Fourth would be resource allocation. This is to identify what resources need to be changed and how we're going to get them. And then so each healthcare facility, each ICU can use these pressure redistributing mattresses, as well as reinforcing proper repositioning and assessment tools. So the last one would be ongoing evaluation. This is going to be a continuous process for each patient, and it also allows for more data to be gathered should there be a need for modifications or alterations of this proposal. So steps 1 through 4, these can have a definite timeline, anywhere from weeks, months, or years, but step 5, the ongoing evaluation, will be continuous and does not have a definite time frame. All right, now barriers. One barrier is the resistance to change. Some healthcare facilities and nurses may find it difficult to adopt this new change of practice. In addition, there may be some lack of resources or limitations that may pose challenges to implement these new interventions. Also, there can be some ethical considerations about fulfilling obligations to promote patient safety and well-being by implementing evidence-based guidelines for support surface management.